Sisters, please help us. Sisters,
Okay, ma'am, please have a seat. I'm going to introduce myself, ma'am. I'm Cams, your nurse here in the ER, and I'm going to take care of you. May you please introduce your name and the person you are with?
And I'm her sister.
Can you please describe what happened to ma'am before she comes in?
2 days ago, she started vomiting. And then, we noticed that she was feeling hot, and so we took her temperature, and then we found out that she has a high fever. And then we also noticed at the back that she has red blotches on her skin.
Okay, ma'am. Can I see it? Can I see it, ma'am? Ma'am Dayan, please wait for a moment. I'll just call the doctor so that she could check on it. Thank you, ma'am.
Good morning, Dayan. I'm Dr. Grace Moya, the emergency doctor today. So how do you feel? Okay, let me check, huh? Dayan, because of your condition now, I can't send you home. So you have to be admitted here in the hospital. Is it okay with you?
Yes.
Okay, nurse, admit.
Okay, ma'am. Ma'am, can you proceed to the admitting office?
Thank you.
I'll take care.
Good afternoon, ma'am. Yes, ma'am. The doctor told us that my sister is for admission today. So, can I have the before anything else, I would like to introduce myself. I am Mitch, your admission officer. Ma'am, can I ask, how do you want me to address you? Nice to meet you, Mitch. My name is Gray. Okay, thank you, ma'am. Ma'am, I am going to give you some forms. Please fill them up while we arrange your admission. So, this is ma'am. Fill this up. Thank you. Miss May, we have an invitation for admission. Okay, thank you. Okay.
Hello, good afternoon. Thank you for calling CBU3. This is Jaja. How may I help you?
Yes, hello. This is May, the bed manager from admission office. Can I speak to the charge nurse?
Hello, ma'am. Yes, ma'am. Speaking.
Yes, I would like to inform you that you have an admission. The patient's name is Diana Rose Omernilio, 22 years old, diagnosis, systemic viral infection to consider dengue fever. Under the service of Dr. Monette Sanchez, is room 220 ready for occupancy?
Yes, ma'am. May. Room 220 is ready anytime for occupancy.
Okay, thank you for the... Ma'am, CBU3, room 220 is now ready for occupancy.
Thank you, ma'am. Here's the form.
Thank you, ma'am. We already arranged the room and it's room 220.
Okay.
Ma'am, I'm going to give you the consent for admission. Please read them before you sign. And if you have a question, you can ask. Also, ma'am, I am going to give you the admission kit. This is for Miss Diana. And also, we have here some brochure for our other services. And this is Miss Diana's identification card.
Here's the form.
Okay, thank you, ma'am. Is there anything that I can help you with, ma'am?
I'm good.
Okay, thank you, ma'am.
Hello, good afternoon. Thank you for calling CBU3. This is Jaja. How may I help you?
Good afternoon, this is Ayan from ER department. Can I speak to the charge nurse on duty?
Yes, ma'am. Speaking.
I'm calling to hand of care of patient Diana Rose Omernilio, 22 years old, female, under the service of Dr. Sanchez. Miss Marnillo with the GCS score of 15, she came in today from home with chief complaints of fever for 3 days already. Her admitting diagnosis is systemic viral infection to consider dengue. No past medical history noted and she has no known allergies. Her latest vital signs as of 2:30 today were as follows: temperature 38.8, pulse rate 89, respiratory rate 20, blood pressure 110/80, not in pain. CBC with platelet count done, still awaiting for results, and still for urinalysis.
Okay.
She has an IV of D5LR 1 liter, a running rate of 125 cc per hour, increasing well on left metacarpal vein. Okay, ER resident Dr. Moya ordered paracetamol 500 mg per tablet. Q every 4 hours, PRN for fever greater than 37.5. Initial dose already started, run the clock. Dr. Sanchez already prepared for the admission. So do you have any questions that you want to clarify?
Ma'am, I would just like to verify patient Diana Rose O. Mernilo, 22 years old female, under the service of Dr. Monette Sanchez with a diagnosis of systemic viral infection to consider dengue fever and to be admitted at room 220 still for urinalysis and to follow up result of CBC with platelet count. Ma'am, may I know what kind of infusion pump to be used for the patient?
Ma'am, it's plum A.
And I would like to verify the paracetamol. It's round the clock, ma'am.
Yes.
Okay.
I have a question. Is the room ready for occupancy?
Yes, ma'am. Room 220 is ready anytime.
Okay, that's good. Thank you.
Thank you.
Ma'am, we have a new admission. It's
Alright.
in room 220. It's patient Diana Rose Mernilo, 22 years old female under the service of Dr. Monette Sanchez. And the diagnosis is systemic viral infection to consider dengue fever. So the patient has an ongoing ITF of D5LR 1 liter running at 125 cc per hour at left metacarpal vein. In terms of diagnostic exams and laboratory, she's still for urinalysis and you have to follow up the result of the CBC with platelet count. So kindly recheck the room if it is ready.
Alright, I will, ma'am. Thank you.
Thank you.
The room is now ready for occupancy.
Okay, ma'am, you have an admission coming from ER.
Alright, thank you, ma'am. Good afternoon, ma'am Mernilo. I am nurse Pat. You are already here at CBU 3. First of all, I would like to check a patient's condition. Kindly verify your name.
Yes, it's all correct.
Alright. So, ma'am, I am Pat. I will be your nurse from 2 p.m. to 10 p.m. And I will be taking care of you, ma'am. So, next up, perform a quick scan. Ma'am, do you have any drug or food allergies? Not really. So, I will escort you to your room already.
So let's go to your
Meanwhile, in caring for level 3 patients, the person in charge in transporting from the ER to the general nursing unit is the ER nurse and the emergency resident on duty. Good afternoon, ma'am. Once again, I am Pat, your nurse for today from 2 p.m. to 8 p.m. First of all, may I hold your hand as I check your ID band? Kindly please state your full name and your birthday. Thank you for that information, ma'am. First of all, let me orient you to the facilities and the room services. And for safety, let me raise your side rails. This is the overhead lamp. And this is the call bell, which you can use for if you need any assistance from the nurse's station. May you please try it?
Good afternoon, nurse station. How may I help you?
Ma'am, just testing. Thank you.
Okay, ma'am.
I will place it on your side. So, with regards to the TV, this is the remote control. These are the local numbers that you can call if you need any assistance. And then for the cabinet, ma'am, you can use the second and the third compartment, while the first compartment shall be used for your stocks, like your syringes and alcohol swabs. And then the ref is ready for use as well, the aircon. And then the CR is also ready for usage. The restroom is ready for usage. The toilet is flushing. The sinks are working. And then, ma'am, let me also orient you to our communication board. As I've written here, I'm Pat, your nurse from 2 p.m. to 10 p.m. Today is Tuesday, November 26, 2013. I would also like to introduce to you our manager, Ayan, and our charge nurse is Ms. Jaja. Our aide is also Mr. John Jason. So basically, ma'am, since you had an admitting diagnosis of systemic viral infection, this will be your health instructions. First is to avoid dark colored foods so that you could avoid the masking of the bleeding from your stool. And then please use soft bristle toothbrush to avoid gum bleed. And then, as I've said, report for signs of bleeding for the nose and from the nose and the gums. And then drink lots of water so that you will be adequately hydrated. And just to remind you, tomorrow we will have a blood extraction, a complete blood count with platelet count tomorrow, November 27 at 5 p.m. So, ma'am, before I leave, is there anything else I can help you with? Thank you, ma'am.